Welcome to Equine Assisted World. I'm your host, Rupert Isaacson, New York Times bestselling author of The Horse Boy, The Long Ride Home and The Healing Land. Before I jump in with today's guest, I just want to say a huge thank you to you, our audience, for helping to make this happen. I have a request. If you like what we do, please like, subscribe, tell a friend. It really helps us get this work done. As you might know from my books, I'm an autism dad. And over the last 20 years, we've developed several equine-assisted, neuroscience-backed certification programs. If you'd like to find out more about them, go to newtrailslearning.com. So without further ado, let's meet today's guest.
Welcome back. I've got two very interesting people. I always have interesting people, obviously, but they're especially interesting, Dr. Rebecca and Dr. Marc Evanko.
Thank you.
Who run Wilder Wood, which is a bit south of Albuquerque in New Mexico. And what makes them, I think, a little bit unique in the equine therapy world, or equine assisted world, is that there's very much an emphasis on female autism. And as an autism dad myself, I've definitely been aware over the years that many women on the spectrum go under the radar. And this can be good, this can be bad, but it is a fact. And where it can be good for a while, it can be bad later. Or even if people do learn to cope without official supports, it can just be extremely stressful. And I think it's very interesting to be looking at a program that really holds this front and center. So Dr. Rebecca, who started this program, is on the spectrum herself and is going to tell us a little bit about her experience. And her husband, Marc, who's a physician, is also neurodiverse with ADD. So together they make quite a discerning combo for how to approach this particular set of conditions and how to bring out the best in people who might be struggling. And they're developing a rather unique protocol, which they will explain. So, guys, thank you so much for coming on the podcast. Rebecca, can you tell us a little bit about your background, your childhood, what your experience as a girl and a young woman was with autism, and why it's led you to the work that you do?
Yeah, sorry. Open-ended questions like that can be quite difficult for me.
Oh, no doubt.
I'm going to let Marc speak for me just a little bit while I process that, if you don't mind.
Yeah, just jump in whenever.
Yeah. So Rebecca, as Rupert, you and I had talked a little bit prior to the podcast, Rebecca was in Queensland, raised by two adults who really did not know anything about autism. There was not much known about autism, especially in females. It was not even known about Asperger's syndrome when she was a young child. And so much of her experience as a young child was being asked, what's wrong with you? And this has, of course, been quite impactful.
Well, I didn't want to do anything. I didn't want to do the social things. All I wanted to do was, I was obsessed with horses. And I just wanted a horse. And of course, we lived in the city and at the time when I was very young, and we couldn't have a horse. And that was my world. And in fact, it was so much my world that everyone referred to me as, between me and my sister, she was the musical one, I was the horse one. And then I think I was about 11, and my mother got a job up in Queensland in the country. And, I was very excited about this because country meant that I could have a horse. And so that was my only interest. So we moved up there and I got my horses, and it was wonderful. But my parents, who had divorced, thought me very strange, very problematic. I had no interest in school. In fact, I dropped out of school as soon as I legally could at the age of 15. And I just wanted to be with my horse, and I would do things like go riding my horse at 2:00 in the morning outside and wander around the town and on my horse. I thought it was a completely natural thing to do. It was very, very atmospheric. There was lots of mist, and it was just wonderful I trusted my horses. I had a great relationship with them. I just got them. And they thought that was very problematic. And why wasn't I going to parties and things? And anyway, they eventually just walked out on me, left me in this little farm that I was on, and at 15. And initially I thought it was wonderful. I was there on my own. There was some bread in the fridge and whatever, and jam and eggs and things from the chickens. And for a couple of weeks, I just lived there. And then I got a knock on the door, and it was the landlord asking where the rent was. And I didn't have any money for rent. I didn't have any parents to go to. I had no idea where they were. And this seems all very strange to some people, but it seemed quite normal to me. And anyway, it was quite traumatic because I got evicted from that place, and I had to lose my horses, which was devastating to me. So there I was with probably a grade 9 education, if you can call it that. I didn't really pay much attention to school, and I sort of had to survive on my own. So I got a job at a gas company, and I've told Temple Grandin this story too, because it's sort of similar to things she'd experienced. I got a job at a gas company that provided natural gas to houses, and I was stuck out the back organizing these, what they called dockets. They were gas receipts. When the natural gas was delivered, the drivers would bring back these dockets or these receipts. And my job was to organize them and sort them into date and customer order. And it was considered a terrible job, but I loved it. Not only was I sort of on my own, I didn't have to interact or do the social stuff with people. I could sit there, and I developed a system to organize all of these gas dockets very, very quickly. And they were just amazed, and then started to sort of promote me into jobs I didn't really want to do. I didn't want to do customer-facing work. I wanted to earn enough money so I could get my own place and get a horse. Well, that didn't really happen until much later in my life, when I realized I'd have to go back to school and get an education so I could get a job that would actually pay enough money to support horses, which are very expensive. And so, long story short, I went back to school and got my GED equivalent, and then got a bachelor's degree, and then I got a master's degree, and then a PhD. And then I met my now husband, and we decided he had horses. And so we decided we would start something up to help autistic people the way that my love of horses and my ability to communicate with horses, and his also, could help other autistic people. And so that's how Wilder Wood came about. And for quite a while, we offered what we called experiences to people to experience some of that interaction between horses and humans. And then this realization that kind of dawns on me after the fact as an autistic person, I think, well, I'd better get some sort of credentials to be able to do therapy properly. So I went back to school a final time and earned a master's in clinical mental health counseling with a focus on rehab and autism, and got that credential. And so now we're starting a proper equine therapy program based on not only what I learned in that program, and I learned a lot, but also my life and experience as an autistic person and a horsewoman, and my husband's life experience with horses, and as a neurodivergent person. So I think that's probably it in 5 minutes.
With a few glaring chasms in the narrative to which we must return. So before I go over to you, Marc, obviously to have one's parents disappear like that is unusual. A couple of immediate questions come to mind. The first one is, did your sister go with them, or did she stay with you, or did she go her own way? I don't know if she was younger or older.
Well, she was 5 years older, and we never got on. And she didn't come to Queensland when I went there. So she was
already out of the picture.
Yes.
And I was on the spectrum too, out of interest?
I don't think so. She was very much like my mother, and my mother and I were like oil and water. So I don't think she was, but I haven't spoken to my sister for, I don't know how long, 35 years.
Okay. And when you say your parents left, so your parents were still together at that point?
No, they weren't. They were divorced. It's very complicated, but I outline it in my memoir, Joy. The story is in that memoir.
Okay. For those listeners who are coming to it new, which most people will, and I'm sure people will want to look at the book, had you then moved up to Queensland only with your mother?
Yes.
And
And
was
then
your
my
father in any way involved at that point, or had he disappeared from the picture?
Well, my father had disappeared quite a few times in my life. It went to Africa, actually, in Rhodesia, and did some questionable things there. I heard stories, but I don't know. He was a very charismatic man. I think he was autistic.
Mm.
And then he sort of appeared back in our life, and my mother ended up getting him a job also at what became the University of Southern Queensland in Toowoomba. So they were both working at that institution for a while.
Was your mother an academic? Were they academics?
They were both academics.
Okay. In what
And,
field, out of interest?
My father was in journalism,
Mm-hmm.
and my mother was in theatre. She was an actress. She was actually trained in London at the Old Vic.
Oh, yeah.
So she was an actress and very much an actress, very much lived her life as an actress. And a very complicated, what some people tell me is a very unusual background, but it was normal to me. It was normally abnormal, I suppose, is one
Sure.
way to
So they left this house that you were in with horses. That's a fairly radical thing to do. How and you were in your teens. You would think that Child Protective Services or some equivalent would have gotten involved at that point. Or...
Not quite. They were living in separate places. I lived with my mother for a while, and then she said to my father, "I can't handle her. You take her." So he took me out on a farm, and I lived with him with these horses. And he was more interested in talking to the 19-year-old co-eds at the university and having relationships with them than he was with me. And then my mother got very sick, and so she went back to Sydney to get treatment, and I stayed with my father. And her friends thought I was a bad influence, so they wouldn't tell me where she was. So I lost contact with my mother that way. And then my mother died, and then my father just was not there one day. So that's the background of...
Do you know where he went? Was there any further story, or was that it? There was no further contact?
I found out about 3 years later that he went off with some student that he then married, even though he wasn't divorced from his fourth wife. And then he died. So it's
the stuff of movies.
Yeah, I guess so.
But the reason I think it's worth knowing the details is that I know actually quite a few people who have a not dissimilar story, and I think it can be both male and female. And I think, it's such a unique experience when somebody finds themselves alone at that young age and sort of makes it work. And I think, however difficult that is at the time, what of course it does is it gives that person incredible resilience and a set of...
I think, yes, I think so too. And I think my autism, I didn't know I was autistic. I think it actually saved me. I never got into drugs or alcohol. I never got into crime. I never did any of that. It was almost like very matter of fact. Okay, well, I'm on my own. I don't have any education. I want to get back into horses. I need money. I better get a job. What can I do? Oh, not much. I can type. But yeah, so I went and got a job, and it was just basically that black and white.
Was there a point where you were homeless, or did you manage to...
Oh, yes.
And how did you survive that period?
Well, there have always been very kind people that I've come across in my life who, for whatever reason, have been willing to help me. So sometimes I would stay. There was a lady at the corner store who I got quite friendly with, and she let me stay at her house for a week or so. And then there was an elderly couple who had actually known my mother. And I ran into them at a shopping center, and they asked me how I was doing. And I said, well, I haven't got anywhere to live. And they said, well, you can come and stay with us for a little while. So, I had people like that who were willing to help me, and wonderful professors who recognized or saw something in me, God knows what, but they saw something in me and they encouraged me. So they've been wonderful people. So even in the midst of all of this horribleness, there have been amazing people who have helped me.
Well, I think this is a really interesting topic, because one of the things that I realized when my son was diagnosed, and we were living actually on quite an isolated ranch outside of Austin, Texas, far from any family, was the importance of tribe. And I grew up with a family where there was always a lot of extended family, cousins and cousins of cousins, and this one once removed and that one 12 times removed. And, because South African colonial families, which we were, even though I was born and raised in London, but there was a lot of back and forth to Africa and constant procession of relatives coming through. When I had the experience of, oh gosh, now what am I going to do? I've got this, non-verbal kid who's just floating away and there is no tribe. Fortunately, I had a sort of a buddy relationship with my next door neighbor, who, even though we were massively on other sides of the political spectrum from each other, we both like to drink whiskey and we both like to ride and we both like to go hunting. And so we would do that together from time to time. He'd pull my leg about being a hippie and I'd pull his leg about being, whatever names I could come up with for his conservativeness. And we actually quite enjoyed that interaction, so that when my son went through the fence and made a relationship with his horse, instead of saying, get off my property, or sorry, you can't interact with this horse because he might fall off and, you might sue me or whatever, there was this immediate, like, yeah, here's the key to the saddle room. And it seems like you had similar relationships with people. And I wonder if this is something you talk about in your programs, the importance of community, the importance of relationship, the importance of tribe and chosen family, even if your blood family isn't, quite meeting requirements. Is this something which, because it's there in your story, you emphasize it all in your programs?
Oh, yes. Yes. For autistic women, which is our focus, we very much emphasize what tribe is a good word, the collective of other autistic women. We tend to get each other in the same way that autistic people and neurodivergent people can connect with horses. We tend to understand each other better. It's very, very important to find that sense of community and sense of belonging, much like it is for the horses and in their own horse world.
Yeah, I agree.
I think one of the worst things that I can think of, well, apart from frank abuse to horses, which is just horrific, is, driving past and seeing a horse standing on its own without any other horses with it, without any other horses to interact with. I think they need each other. And I think that people need each other, and particularly autistic people need to find each other and connect with each other because we get each other.
I would wholeheartedly agree. Now, there's one last gap in the narrative before I turn to you, Mark. It's rather a long way geographically from Queensland to New Mexico. So the meeting of Mark and you guys deciding to put this place together, obviously there's a backstory there. How did you end up in the USA and how did you guys end up meeting?
Well, as briefly as possible, one of the ways that I survived was when I was quite young. I thought it might be quite a good idea to get married. I thought it would be a way to, find security. And so I got married fairly young. It was a dreadful mismatch. He was a very good man, but he was into car clubs and barbecues and I wasn't. And when I went back to school, we kind of separated and just realized it was just hopeless. At the time when I got getting my first degree, the internet was brand new. And being a cocky little undergraduate, I read an article by a professor in the US, in Texas, that I disagreed with. And at the bottom, there was an email address. And I thought, I'm going to write to this person and tell him just why I disagree with his article using this thing called email. And so I did, and he wrote back. And that started a relationship. So I ended up flying over to the United States on a student visa. I finished my baccalaureate degree here. And I married this professor. That relationship didn't work out either. And I divorced, and I had my PhD. So I was doing various work around the country and not in a relationship, convinced that I would never find anybody who would be able to put up with me. And I was seeing a psychologist at the time, and the psychologist suggested, well, why don't you just give it one more go at finding someone? I said, it's no point. There's nobody who'll ever put up with me. And so, I went on to one of those, I think it was Match. And I put in my details, and this picture came up of this very attractive man who was standing there with this jaw-dropping, gorgeous Arabian Trakehner horse. And just
well played,
looking,
Mark.
yeah, right, just looking into his eyes. And I said, any man who looks at a horse like that is worth talking to. And, of course, at the time, people had told me, well, you've got to create these profiles to make people interested in you. And I was driving a Porsche at the time because, hey, if I couldn't have a horse, they could at least have horsepower. So I had this picture of me sort of leaning over this Porsche, and I used it as my profile. And so I contacted this guy. He looks at this profile and he thinks, lady, you've got the wrong guy. I don't care if I walk through
You realize
the
how many
mud.
horses you could buy for that Porsche? Yeah.
Yeah, exactly. So he sort of, didn't you? He kind of wrote back and said, I don't think I'm the right guy for you. And then I didn't really think anything of it. Really, I just sort of kept you as my favorite, and then you can finish the story.
Well, so in that story, I looked at this woman, beautiful woman, over the Porsche, and I thought exactly what she just mentioned. And I said, your high heels are not going to work here. It just goes through mud, and you're going to be cleaning poop.
You've got sand in your bed from the poodles.
Right. I've got 3 dogs, large dogs, and they're on the bed and they're not getting off. And this was my profile because I had been through a divorce, and that's what brought me to this very property with Saeed and Ritzy, Tennessee Walker. And I could not fathom that I would be together with someone. But my friends said, why don't you just try this after about 10 years of being completely single? And so that's when I said, no, you're not the one for me. And then to kind of turn the knife, about 2 weeks later, I saw her thing come up again on Matt. And I said, am I still your favorite ? And she emailed back on Match and said, well,
Sure.
yes.
And we sort of started talking from there. That's how that happened.
Cool. That's a great story. Thank you. Mark,
Yes.
ADD, also neurodivergent.
Mm.
Can I have your bio leading up to this point too? Because I think
Sure.
it's unusual and valuable to find a program that's run by 2 neurodivergent people. So what's your story? What's your perspective?
Much in contrast to Rebecca's story, in her early life, I was raised by 2 parents who were together until they both died, essentially. And large family, 8 siblings.
Wow.
And
where was that? Where in the US was
in
that?
New Mexico. Yeah.
Okay.
In New Mexico, in Albuquerque. And I had what I would consider to be a relatively stable and quote normal life. Went to school, finished high school, straight to college, straight to medical school, almost straight to medical school, did 2 years of research. Before that, really never really rode horses until I got back from medical school. Didn't have the money.
Did you always want to? Had that always been a desire?
Interestingly enough, no. I was a camp counselor at one of a YMCA camp close by Albuquerque, about 70 miles So it's 80 kilometers away from Albuquerque. And we would take the campers out with the rancher who donated his time and his horses. And then I'd get to ride with the other counselors through this beautiful meadow that was huge. Actually, a volcano crater up in the Jemez Mountains. He allowed us to do that, but that was really my horse experience. My mother rode horses and she did dressage, and she actually had a Tennessee Walker as well. And so it was interesting that when I returned from medical school, I met my first wife, and she came with a horse. And the horse that was born in the stall next to hers is Saeed, the Trakehner Arab that Rebecca mentioned. I figured if I was going to learn how to ride a horse, I wanted to learn how to ride a horse well and not need to do what many Western riders do around here, which is muscle the horse around and use the bit as a weapon rather than as a kind and gentle way to ask the horse to follow you in that dance. So I started taking dressage lessons with a green 2-year-old horse who was extremely athletic,
Very smart.
and very smart. And I'm a green rider on a green horse. Not the best combination.
Quite a way to learn.
Quite a way to learn.
Green
And-
equals black and blue. Yeah.
That's that is right. And so we together went through 3 or 4 instructors before we met James, our current James Reedman, who is our now Col de Légèreté instructor. And he took me and Saeed up to the 4th level of dressage, and we're very grateful for that. It's interesting, though, because one of the things I learned about dressage is that it isn't necessarily, especially in the competitive aspects of dressage, not necessarily the kindest to the horse.
Sure. Well, anything done competitively becomes a caricature of itself. Yeah.
Yes, and that's I did not realize that until we started showing, and James is like, is this what? And he knew at that time that that was really not what he wanted to do. He wanted to do true classical dressage, but could not find it here. And when he met and learned about légèreté, immediately he switched and is now a trainer, one of only a handful in the United States. And luckily he is right next door to us here down in Peralta. So that's my horse experience.
Yeah, let's talk a bit about your ADD and also what kind of physician are you and how does that
I'm a
activate?
GP. I have done a varied amount of activities as a GP. It's interesting how times have changed. I early in my career did ER and urgent care and ICU work simply because of the way we were able to do things then and the liability and all of those things that have changed. So I have a lot of experience in a lot of different areas of medicine. My training as an osteopathic physician here in America actually gives me a different view of the human condition than many allopathic physicians. And I chose osteopathy over the allopathic profession because I felt it was a much more comprehensive way to look at the human condition and medicine. And so that's why I'm a DO and not an MD.
Got it. Yeah, that brings, I think, quite a holistic perspective. Tell us a bit about your ADD. When did you realize you were ADD? How has it impacted your life? Do you consider it a superpower? Do you consider it a disorder? What's your take?
Like any, okay, so the first question is how did I learn that I was ADD? Well, ADHD. It was actually, I was probably, and from the time I was able to remember, 2, 3 years old, my mother would frequently ask me or tell me, sit down and be still. Sit down there and be still. And
Did that become the litany for your life after
that was kind of the litany for my life. And I'm sitting here right now as still as I can be, but my legs are going.
Having to sit on your hands. Yeah.
Yeah. And so that was how I learned to do the compensatory skills that I needed to actually calm my mind enough that I could take in information and be able to, without medications, do what I did academically and scholastically, and be able to take things in. But please don't ask me to remember something 5 minutes later, because I won't. If you and I are talking and would you go get this? Okay, I'll do it in just a minute. It doesn't get done. Mark, take your pills this morning. Did you take your pills? I think I did. Here's your pill. You put them out.
I put them out for you.
Right. That's the only way it'll happen. I mean, I may remember this evening because I walked by the cabinet where, the pills are, but the story that I would tell my clients, my patients, to help them diagnose themselves as ADD is my story about very common in my life. I need to rake the leaves out in the yard. So I'm on my way to the garage to get the rake. And I pass by the hose that hasn't been wound up for 3 or 4 days. So I start winding the hose up. And then I remember that the spray thing on the end of the hose is broken. So I need to go to the Home Depot to get another one of those. So I'm on my way to Home Depot and I get 4 other items and I'm on my way back and think, I didn't get the thing for the hose. But what was I originally going to do?
Rake the leaves.
Yeah. And so this is my life. I'll put a tool down and where did it go?
Whereas I, in contrast, would have the compensatory strategy of using a moleskin to plan. Tomorrow I'm going to rake the leaves at 9 o'clock. So at 9 o'clock, I go out to rake the leaves. Don't you dare disturb me. Don't change my plans. Don't do anything differently. I'm raking leaves from 9 to 9:50.
And I'm very good as long as there is someone in practice. For instance, my front office people would just say, doctor, go into room 6. Okay. That I could do, and that I could focus on my client, my patient. But outside of that room, going in the halls and out, distraction.
I'd like to jump in here, if I may. You talked about compensatory strategies, and I think that was incredibly important to me. My experiences may have been unusual and disturbing and upsetting, but it taught me a whole lot. I had to take care of myself because there was nobody else to do it. I had to develop strategies to do that. And Temple Grandin talks about this a lot too. She expresses concern about autistic kids not being given enough, responsibility to be able to develop these alternative strategies. So I developed very specific ways of doing things that I maintain to this day, very complicated executive functioning setups that work for me, that I developed, that people look at and say, oh my God, look at what you do to get this done. But it gets things done, and it taught me that I had to do it. So I think that's something also that we emphasize. If a client comes in contact with a horse, if they're afraid, they don't really know what to do, I'm not going to stand there and tell them how to do it. We'll just stand in silence and wait until there is some form of communication, something that happens, which we can then leverage and say, did you notice this happening? You can work out how to do this on your own terms. And I think that that's a really important phrase for autistic people, learning to do things, but on your own terms, rather than trying to get to some non-autistic ideal you'll never reach anyway.
Yeah, I think I'm in agreement there. With all our programs, it's predicated on something called follow the child. And you could also replace the word child with adult or yourself or whatever. But the idea is intrinsic motivation has to be the way. No amount of good boys, gold stars, or the other kind of motivation, which is, of course, negative, will get the job done. And it was Temple Grandin, actually, who schooled me very early in that. Said, Rupert, you've got to follow the child physically, emotionally, which means sensorily and intellectually through what they're interested in. And it made so much sense to me that I was like, yep, absolutely, got it. And I just did that. And of course, everything that we do flows from there. So I'm right with you there. Quickly before I want to move on to your programs, but Mark, just quickly with you, when were you diagnosed with ADHD at a certain point? And then you mentioned medications, but you also mentioned no medications. I presume that as a boy, if you had been a boy now at school, you'd have been medicated like boom. Did you then come to be medicated later, or did you manage to avoid medications, or what?
No, I've never been medicated.
The pills you were referring to are not ADD pills.
No.
No, they're not. No.
It's interesting.
He's racked up his body through falling off horses.
And motorcycles,
just
and yeah.
No.
I'm kidding.
Yeah, but so the answer is I've never been medicated for ADHD.
Yeah.
The support that I got and just being accepted, interestingly enough, by family and I'm sure I had friends in school, high school, who were also, and we just kind of were there. It's interesting because there was much more of he's a little weird, but he's okay. He's not hurting anything. And instead of this confirmation, we have to conform and have this child conform to the way things are. That seems to be going on a lot more these days. So here's the medication. Medications can be very effective tools for all kinds of different conditions. I mean, I am on high blood pressure pills now that I got long COVID. I was stricken with COVID from when I was working at urgent care early on in the COVID circumstances. I got COVID before there was even testing for it, and ended up in the emergency room myself with blood pressures in the 200s over hundreds. Whereas a week before, I was on zero medications. Zero, except for some ibuprofen.
Got it.
So those are the medications I'm on.
And when did you get your diagnosis?
I'm self-diagnosed.
Okay. And similarly, Rebecca, were you self-diagnosed or did someone give you a diagnosis?
If you're in the equine assisted field, or if you're considering a career in the equine assisted field, you might want to consider taking one of our 3 neuroscience-backed equine assisted programs. Horseboy Method, now established for 20 years, is the original equine assisted program specifically designed for autism, mentored by and developed in conjunction with Dr. Temple Grandin and many other neuroscientists. We work in the saddle with younger children, helping them create oxytocin in their bodies and neuroplasticity in the brain. It works incredibly well. It's now in about 40 countries. Check it out. If you're working without horses, you might want to look at movement method, which gets a very, very similar effect, but can also be applied in schools, in homes. If you're working with families, you can give them really tangible exercises to do at home that will create neuroplasticity when they're not with you. Finally, we have taquine equine integration. If you know anything about our programs, you know that we need a really high standard of horsemanship in order to create the oxytocin in the body of the person that we're working with, child or adult. So this means we need to train a horse in collection, but this also has a really beneficial effect on the horse's well-being. And it also ends your time conflict where you're wondering, oh my gosh, how am I going to condition my horses and maintain them and give them what they need, as well as serving my clients? Taquine equine integration, aimed at a more adult client base, absolutely gives you this.
No, I had a breakdown. I was working as a dean, a college dean, and I just reached a point where I just couldn't do it anymore. And I broke down and was weeping under my desk. So I got to see a psychologist, and fortunately I lucked out. There was a woman psychologist who knew something about autism in women. And so I was talking to her, and she brought it up, and she said, Rebecca, I'd like to talk with you about autism. And I didn't believe it. I said, don't be ridiculous.
No one else had suggested that to you before?
No, I was diagnosed as a child with childhood schizophrenia because the psychiatrist, they always said there's something wrong with that child. That was my mother's constant refrain. And the psychiatrist had asked me in the office, I was about 9 or something, do you hear voices? And I was very literal. And, I said yes, because, of course I heard his voice and I heard people speaking. There was nothing wrong with my hearing.
Right.
And so I was promptly,
How old were you at that time?
About 9.
Yeah.
And that diagnosis was absolutely incorrect because I didn't hear the types of voices that he was talking. I didn't have delusions. I didn't have, anything. I was very introverted. I just wanted to be around horses. So they saw that as being kind of, not wanting to be around people. But anyway, so, I always knew I was kind of different. But when this psychologist talked about it, I started to learn more about it. And then I was re-diagnosed when I came to New Mexico because I wanted some accommodations for my second master's program. So I was re-diagnosed by another psychologist with whom I work now, actually. And that, so diagnosed twice, but yeah.
It's
the women that,
go
sorry,
ahead.
go ahead.
No, you go ahead. And then
Well, the women that we have seen as part of this major research project to develop this new instrument, that is one of the most common things that we hear, this history of misdiagnoses, everything ranging from schizophrenia, anxiety, depression, borderline personality disorder, bipolar disorder, OCD, or social anxiety disorder, all of these disorders. Some of them certainly can exist co-occurring with autism, but just a history of seeking answers without really getting anywhere.
Yeah, I agree. I think when it comes to the misdiagnosis in the work that I've done, it definitely seems to be a more female thing, almost as if when girls are at school age, it might be changing now, the assumptions of autism tend to go to boys, unless there's something, it's like super severe, not speaking at all. Okay, fine. Then, but if it's anything milder than that, and then there's a lot of flying under the radar, or as you say, getting these false diagnoses. And one of the things which I often find, I can understand it, but it's a symptom actually of how mentally ill our society is, I think, in general, is the fact that all of these things have a D on the end of them. Disorder. I spent so much time in the Kalahari. I'm sure that I'm ADD or ADHD, but I regard it as something that allows me to have parallel careers, live parallel lives. Yeah, I'm forgetful. Yeah, I'm absent-minded. I mean, you could have described me, Mark, with your thing of those distractions, but probably actually I'll get all of those things done. And if you look at the end of the month, actually, I've got them all done. It's just the time frame might have been a bit strange. But that allows me to do things like make a film and write a book and train a horse and go travel over there and kind of keep track. Even though I lose track in the short term, I can kind of keep track. And when I was with his son, with the Bushman in the Kalahari, and I was observing a lot of hunting and gathering, I realized, oh, you have to be like that because you have to constantly adapt to new circumstances. When you're hunting, the wind changes, suddenly there's elephants over there, for a bazillion reasons, you might have to stop on the fly and do something else and have 10 other plans. When people joke about, oh, squirrel, it's like, well, yes, because that squirrel might be your lunch, and if you're walking to see your friend and you notice antelope tracks, you're going to, sorry about the visit, but I'm on these tracks now because if I can get that antelope, actually, I'll feed you. And this is, so these things aren't disorders unless one is in a society where this personality type is not valued or not understood. And then, sure, it's regarded as a disorder because then there's such a narrow economic, because it really comes down to economics. I think there's just such a narrow economic participatory field, if you like, that anything that isn't, as you say, completely within that field gets labeled a disorder. But if these things were all disorders, given that people have had these since there were people, then we'd be a very inefficient species, but we're not. We're the dominant species. So presumably there's more to these things than meets the eye. But I absolutely agree with you on the female misdiagnosis and the confusion and the misery that this can cause, and the loss of self-confidence and the loss of ability to swim in the world because you're always being told you're using the wrong stroke. So with that in mind, go ahead, sorry.
To one of your points, then that just made, one of the metaphors that I have come up with is what brand of phone do you use?
I use a Samsung.
A Samsung? An Android. So do we, actually. Not a Samsung, but, well, you've got a Samsung, I think. There's basically two different operating systems, yes? Yeah. Both of them work. Yeah. Samsung, you can do everything on a Samsung essentially that you can do on an Apple, an iPhone. Nothing wrong with either phone.
Yeah, exactly. Yeah.
That's the metaphor. Yeah.
All right. So here you are, you decide, okay, Rebecca, you've had this life experience, and at what point do you guys decide, actually, let's start something therapeutic with the fact that because you've both got jobs, you've both got careers at this point, Rebecca, you've achieved your goal, you have a home, you have horses, you have a good relationship. So why then go this extra mile and start Wilder Wood?
Well, we wanted to find a way to highlight that connection that we both believe can exist between horses and humans. We wanted to do something to help other people, especially autistic people. And so how it all started is I first sought certification through a very well-known certifying organization because I thought that would be a helpful thing to do. And that organization actually had training on autism and the therapeutic riding relationship. So I started enrolling in that, and I was getting more and more frustrated, and Mark was noticing that, and he said, what's wrong? I thought you wanted to do this. And I said, well, what they're teaching is not going to work for autistic people. It's just not going to work. It's not going to work for me, and I'm not doing this. So there's that black and white autistic thinking. I shut it down. And, so I called them and I said, when you were designing this program, did you get actually any input from autistic people? And there was this pause on the phone, and they said, oh, that would probably have been a good idea. And I said, yes, it would have.
Well, at least they were honest enough to say
They were honest. They were very honest. And then I just said to Mark, look, I don't want to do this. I want to combine everything that we've done, all of our life experiences, our horse knowledge and whatever. I just want to do something based on what we do, what we know, and put it out there. And so that's when it started. It started really with a laptop in our living room and deciding to do this. And it's grown from there and evolved, as any healthy organization does. And now we're shifting off into this research component and this equine equitherapy and counseling component. So it's grown up to there.
It's great. Just your point, I'm going to ask you to go through your three main programs here. But just quickly before I do, it's very interesting, this point about not looking to the people that have the condition to advise one about how to approach the condition. Because my background is journalism. So like when I tried ABA, other types of things too, observed very quickly that they weren't working. And then thought, well, okay, fine. And it hadn't occurred to me to do anything with horses, despite the fact that I'm a professional horseman, because my son's behaviors were so erratic. I thought he wasn't safe around sport horses, which is what I was doing. And I was probably right, actually, at that time. He wasn't. He created his own relationship with the mare Betsy, as I spoke, and then we followed that, and that was a very different path. But what I did do when I said, okay, well, fine, I don't know what I did what the people told me to do. Didn't work. So now what do I do? It was the obvious thing to me to do, to reach out to Temple Grant. It's like, well, there's someone with autism who started non-verbal like my son, pooing in her pants, wiping it on the walls, just like my son. And now she's made it. Well, that's the obvious person. Who else are you going to go to for mentorship? So I sat in an office with her and said, how does my son become you? And she said, do 3 things. I did them, and everything went from there. But I remember going back to the other therapist and saying, this is what I went and did, and getting it thrown back at me that I was like some terrible parent. And I was like, well, based on what? Okay, fine, let's just go our separate ways. Fast forward 20 years, Rowan, my son, last year was actually hired as a consultant by a study at Manchester Metropolitan University in the UK to consult on how to make equine therapies better for autistic people. And he was one of a group of autistic consultants, of people who'd actually had a lot of equine therapeutic approaches, and what did they think could work better and what could be improved, and which, it's such a rational and sane approach, but it's taken 20 years. And he now is on another panel for that, and he helps me do trainings, and he explains to parents and practitioners. But of course, as you know, this wasn't around back in the day. It was everyone and their opinion, and you either were lucky enough to luck into an opinion that held water, or like most opinions that didn't. So now you are one of the evidence-based, partly through your own experience, programs out there. You've got, I was on your website, you've got Autism, you've got Equitherapy, and you've got Radiance, a research tool with a W on the front, named after a horse that you have that's a warm blood of the same name. Can you just talk us through, a lot of listeners will want to know what your programs consist of. So can we start with Autism, then go to Equitherapy, and then go to the Radiance? Would that be all right?
We certainly can. Autism is kind of an overarching principle. There is a connection between, there are certain similarities between autistic people and horses. I'll give you one example, parallelism. Often you'll see horses out in the field who are communicating quite effectively with each other, but they're parallel. They're walking parallel. They're interacting on a parallel basis. Autistic people tend to do that too. We don't need to be, in your face, making eye contact, talking with you. I'm quite happy to sit here parallel to my husband and do my work and not necessarily interact, and I'm having a great time. That's one example of it. So it's based on a premise that there are similarities between the autistic way of viewing the world and an equine way of viewing the world. It started off with that as experiences based on that idea. We did not do therapy because I was not credentialed at that time to offer it. So it was more of a interaction with horses, just interacting in the way that felt right for the person and the horse. So autism as a concept is kind of a principle more so than a program now. I am now qualified. I have the master's in counseling, and I have designed a program called Counseling and Equitherapy. It offers both. It offers equine assisted therapy and also counseling that can take place without the horse. So it's kind of a dual counseling approach, but it is absolutely steeped in autistic knowledge, autistic preferences, honoring autistic communication, honoring equine interaction. And so clients can choose to do either. The equine counseling, the equitherapy is entirely ground-based, and we incorporate the principles of leisure-te interaction. So acknowledging the horse as a partner, recognizing the importance of communication, however that takes place, not about structured rules in terms of this is the way the horse is going to behave, but what communication can we engage in? What feelings and emotions rise out of that engagement? And how can we analyze and assess and synthesize those to make sense in a broader context to someone's life? Those are the principles of the equine therapy, and also the counseling as well, specializing in autistic women. And because of that, there is a large grief component that is addressed, because grief is one of the strongest feelings that can be present in a late diagnosed autistic woman's life. Grief over lost opportunity, grief over spending a lifetime thinking there's something wrong with me, grief in having to constantly mask and camouflage and not be authentic. All of that needs to be worked through, particularly after a diagnosis. So it's very much a niche counseling base. And like most things I do in my life, I like to say slightly north of normal. It's unusual. A lot of it is based on, as you were talking about, what feels right in this situation. And, yes, learn and listen from others and take pieces of it, but put it together in your own unique way. That's how you can make a difference, I think. That's how you can advance whatever it is that you're doing. As far as the Radiance is concerned, that's our research arm of what we do. And we were very concerned about the standard and quality and caliber of assessment instruments to identify autism in women. So about 4.5 years ago, we decided to change that. And, based on our knowledge and understanding, my PhD unwittingly looked at aspects of autistic communication. I didn't know it at the time, but it did. We came up with the idea to develop not only a new instrument to psychometrically assess for autism in women, but develop a new protocol around it as well. So we came up with a survey instrument of 150 items of childhood and adulthood. And we initially started with an interview-based assessment protocol. We quickly realized the interview-based was not going to work.
Why not?
Because an interview is based on spontaneity. It's based on social communication principles of interaction.
Okay,
These
so
are
this
things
wasn't
that
like
autistic women...
a written interview. This was actually a face-to-face interview.
Face-to-face interview.
Ah,
Yes,
right.
it was a struggle, but this is the way the paradigm is.
Mm.
It's based on observation. It's based on interview. So I went back again to my own background. My BA's in English, my master's is in rhetoric and composition and literary analysis, and my PhD's in cognitive linguistics. So I went back to that and I said to Marc, we need to do away with the interview. We need to have them construct a narrative and analyze that narrative through critical discourse theory to bring out themes of what constitutes female autism and build our instrument and our protocol around that. So we solicited participants, and after 4 years now, we've got over 900 assessments that we've done with input and narratives from over 900 autistic women across the world that have enabled us to identify recurring themes of what autism looks like in women and adjust and create this instrument and protocol of assessment that is much more finely nuanced to what's actually going on in autistic women's lives. We're very excited about it. Not many other people have been excited about it because it's a huge diversion from the paradigm. The so-called gold standard instruments we think are quite problematic.
Can you give me an example of what people consider at the moment a gold standard instrument?
The ADOS 2 Module 4 the ADIR
And
interview-based
and how,
assessment.
because they're based on face-to-face interviews, or
They're based on neurotypical norms that were standardized on male autistics, also on observation. There's a component of the ADOS-2 that involves storytelling, and it's based on an outdated understanding that autistic people do not and cannot have empathy.
that all checks
Um,
out. Yeah.
There has been something out of the University of Newcastle in the UK called the ACIA interview protocol that we were actually trained on. And it's a step forward. It does actually acknowledge some of the things about autistic people, but it's interview based. And it doesn't have a compendium instrument that has been normed on autistic women, 900 of them. So we are very excited about the Radiance. We've just finished phase 2, which means we're not accepting any more participants. Now we figured, I think 938 is what we're at right now. So we're just about to start venturing into clinical trial, where we have the clinicians, and I think we've got about 16 who are interested so far in actually taking this instrument and protocol into their own practice and using it in the field to assess. And as part of that phase 3, we'll get that data back, make modifications if necessary. I'd like to think there will be no modifications, but there will be. And then once that's completed, then that instrument will be ready to publish and hopefully be used. So we get to the point where women who think they're autistic say, I want a practitioner who uses the Radiance instrument and protocol to assess me.
So it would effectively be a diagnostic. It's a diagnostic tool.
It is.
Absolutely.
Yeah.
Let me just put one point in about the Radiance that really sets it apart from even the other surveys that are done. First point is that there is no other survey that was devised by autistics. They're all devised by non-autistics.
Right.
The one huge problematic part of any of the surveys that we actually used parallel to the Radiance survey is the Likert scale, where people are putting themselves to numbers. Very problematic, as almost as problematic as the interview, in that the client gets caught between numbers. I am not really a 4, but I'm not a 3 either.
Sometimes I'm a 2.
And sometimes I'm a 2. And depending on the context, I could
Yeah.
even be a 1 on this particular. And so struggling through those surveys, which we are delivering actually side by side with the Radiance, because they are, quote, the gold standard. They get to the Radiance, which is a true-false format of response. So an item on the Radiance may say, what would be an example? I only wore one color, or did not like a certain color very much. True or false? Yes or no? Well, yes. I mostly wore black when I was in elementary school. I just didn't care about picking out any colors or matching. Didn't like it, would be the comment that we got. That true false is so much more quick to come up with the actual response. We time it, and our clients go through a 65 item non-autistic derived Likert scale based survey that the 150 item Radiance is done in approximately half the time, because the answer comes so much more quickly, and the relief that our clients express immediately following the Radiance versus struggling through the
I think two of the comments that we get that's so heartening to us is we very often get women who say, oh my God, I feel so heard. I feel so seen. And we say, well, yes, of course you do, because this has been created by input from autistic women. And the other question we get is, doesn't everybody feel like this? Doesn't everybody answer true to these? And, of course, in the scope of our research, we administered it to non-autistic people. The answer is no. No, it's quite distinct, the difference between an autistic response to a non-autistic response. And the true falses are weighted. They're weighted depending on the research that we did based on the responses of non-autistic people and autistic people. So it's quite a complicated scoring system. But it's just fascinating to us that these women think almost uniformly. Doesn't everybody think like this? And it's a bit like that line from Temple Grandin when she was in the film that was made about her. The same realization. Doesn't everybody think like me?
Yeah.
No, they don't.
She was 35 years old, she said, before she understood that not everybody thought this way.
Yeah, theory of mind, absolutely.
Yes.
Doesn't come as naturally as one might
No.
think. No, absolutely. And I think that's often one of the things that is where people mistake the mistake about lack of empathy, I think, is actually more accurately perhaps impaired theory of mind. But that doesn't mean lack of empathy. That just means a different way of expressing empathy. And
Yes.
I remember, back in our early days with autism, hearing that kind of lack of empathy thing. I have this very loving little boy who,
Yes.
but who would express it differently. And definitely we have to help him with theory of mind, but that's a cognitive thing. That's not an emotional response. The emotional response is right there and it's bang accurate. He's not a psychopath. He's just expresses it differently. And I remember finding that perplexing, and then I say, is this because in fact a lot of people doing the diagnoses are in fact, and perhaps a lot of these tools were in fact created by Asperger's men who might have had difficulty themselves with some theory of mind, and might have had a somewhat rigid worldview. I mean, I'm thinking about people like Lovaas, who invented, I had a really interesting interaction years ago. I was in Houston and we were doing some autism thing or other. And I was talking about the not great experiences I'd had with ABA. And somebody said, I was Lovaas's housemate at university.
Oh, wow.
85-year-old guy. Yeah. And I was like, what are the odds? I said, well, tell me. He said, well, Rupert, he was obviously Asperger's. And he himself had, suffered a fair old bit. And then he'd grown into a very big man who could use himself very forcefully, and was just very interested that after the war, this new topic of autism, and then there was Asperger himself over in Austria, and he saw this as an opportunity, but he didn't care from children at all. It was just a way to make a mark within psychology. But was he on the spectrum? Probably. That's what he said. But had he been somewhat brutalized? Yes. And therefore, was that how he was going to approach things? Sure, because he was a product of the time. And well, the rest is what we know. But it's interesting that, so of course, being, as being autistic doesn't make one a saint or a sinner. It just makes one what one is.
Autistic.
Yeah, but it's, what's clear is that the inability to see nuance, I agree with you, does seem to be weirdly built into the frameworks of the diagnostic tools and of most of the therapies. And given that we're dealing with humans who, as you say, if you give them what number are you, they'll say, well, on Tuesday it's 1, but by Thursday it has to be 6 because of my menstrual cycle, or the fact that we've got a low atmospheric pressure, or I ended up in this situation with this authority figure which automatically presses my amygdala, so therefore I become a 2. And then you could look at that and say, well, that's anybody, right? Yes, because we're all human. So if we're autistic human or non-autistic human, we're still human. So I think if the aliens were to come down and look at us and go, well, okay, that one's got a diagnosis and that one doesn't, but they all look kind of the same, and they kind of get upset about this and not upset about that, more or less, and it shows that they are more nuances and personality types, I think, than but we can make too much or too little of them. but I agree with you, when it's about actually trying to do a diagnostic tool, then that's when one has to dive into the nuance and make it a huge thing. Otherwise, how can it work? Particularly if it's going to work across the board. The question that comes up for me when you're describing this, of course, is I'm thinking, well, this of course would work for presumably male autistic people as well as female autistic people. So the radiance thing, surely that's something that could work across the genders, or do you think it's specifically female?
Well, we started off by including males and in the first phase of the research, and then we decided we're just going to focus on females. So yes, we have used the radiance to assess males, not very many compared to the females. And I think that as an instrument, yes, it could be used, conceivably be used. It's an adult assessment instrument, but I can say that our focus and our interest is on autistic females and as they present. So, yeah.
Do you think, though, perhaps, if we look forward 20 years and let's say radiance is, it's a thing by then and it's a diagnostic tool, do you think there's just a natural evolution that then there would be a radiance for men as well?
I'd like to see that. I think that that's probably an area that someone else could take on. At our age, I think we're sort of coming to the end of our research careers, and the radiance is something as our contribution to it. Yeah, I certainly hope that there would be more research that's done that's based on input from the people who are going to be served by the instrument.
I'd like to throw in a point about this, is that the diagnosis of males has largely molded the stereotype. And so males are generally much more easily diagnosed. Not that they're more in number necessarily. It's just that they are looked for much earlier in their lives. One of the thoughts about that is because females actually are much more easily masked and learn these nuances, don't know what to do about it, but know how to mask themselves so that, as you mentioned earlier, they fly under the radar. As until about middle school, 7th, 6th grade, when the social pressures really start kicking in, and it becomes way more than that female, that girl, can handle. And she comes home after having been so smiley and so wonderful at school, and the teachers all love her, and she's extremely smart, and comes home and melts down at 4 o'clock in the afternoon and can't communicate with her parents, and is throwing things and is having fits over, I can't do this anymore.
That wasn't me at all.
Yeah, no. So
I totally see the logic. Here's a question, practical question. So let's say that same girl in a couple of years goes through a radiance assessment and gets the diagnosis. What could, particularly within the American system, what could change for her because of that would be to her advantage?
Testimonials. We've actually got unsolicited emails back from our clients, not just at the age that you're talking about, but across ages, saying, I can't believe how it's changed
everything.
Perception of myself and everything around me. And I am so able to now navigate simply because someone has heard me. The imposter syndrome. Am I or am I not autistic? I'm acting this way. Well, maybe I am borderline personality. I've been told that. It doesn't, I've looked it up. It doesn't fit. Well, and then somebody told me, a counselor told me I may be autistic. So I did my deep dive in autism And by gosh, that really seems to
That
fit.
explains so much.
And now I can ask for just incandescent light in, at my desk.
I know
or
why fluorescent
my-
light bothers me so much. I know why I can't spontaneously contribute to these meetings at work. I know why I prefer to send email than the phone. And I'm okay. I'm okay. Somebody asked me that question actually there once. They said, well, what'd you bother getting a diagnosis for? You're not going to be able to access services. It's not going to change anything. You're 49 or whatever it is. Why'd you do it? What difference does it make? And I thought about this question and I said, it changed everything. It changed
Yeah, no,
everything.
that I can
Because for
absolutely see. Yeah, no, that makes perfect sense to me. Self-advocacy, effectively, and definitely within our programs, self-advocacy is always kind of what we're aiming for. That somebody can say, "Okay, look, this is me. This is what I'm going to need." But in return, if you can accommodate me here with these environmental things, these sensory things, etc., I
Well,
can
not
give
so
up
much
my best.
self-advocacy as it was self-understanding. For the first time in my life, I could look at myself and say, there's nothing wrong with you. After being told my entire life, there's something wrong with you. You don't fit in. You're the constant. You're the one who's got the broken relationships. You're the one who can't keep a job. You're the one who can't stay at school. You are a problem. For the first time, I said to myself, I'm not a problem. I'm autistic. And I think differently. It
Right,
was
no.
life-changing.
Absolutely get that.
If you're a horse nerd, and if you're on this podcast, I'm guessing you are, then you've probably also always wondered a little bit about the old master's system of dressage training. If you go and check out our Helios Harmony program, we outline there step by step exactly how to train your horse from the ground to become the dressage horse of your dreams in a way that absolutely serves the physical, mental, and emotional well-being of the horse and the rider. Intrigued? Like to know more? Go to our website, heliosharmony.com. Check out the free introduction course. Take it from there.
I'm thinking about the girl that you've just described who's melting down when she gets home from school, because school is school. It's one of the reasons, for example, why we have this program called Movement Method, which was originally a homeschool program for my son, which is now, to my astonishment, been taken on in schools. But it was specifically trying to address this. Let's say that girl that you just described, she's getting home, she's melting down, so the relationship with the parents is now compromised. So that means the home environment is compromised, and so on and so on. She goes through the assessment. She gets the diagnosis. Do things improve for her? Because then when she gets home, her parents know she needs space, she needs time to recharge and recover. And therefore, the demands that we can make need to be rethought because she's exhausted by what she's had to, the energy she had to expend. So therefore, things go better at home. So therefore, is that where, and she can then go to teachers and say, or parents go to teachers and say, look, this is what's going on with her. Can we make certain sensory accommodations? Can we this? Can we that? And then, yeah. How does it get better for her?
Well, it would be better. More education is needed. There is a huge amount of misinformation about autism in females. The program that I have just gone through, the 3-year program, did not mention autism in females once. It was mentioned in children. And the only time it was mentioned in any of the textbooks or discussions that I had in an adult was in a male with intellectual disability. So a huge gap. I think the type of programs that you're offering would go a long way for that hypothetical girl. She would not take the Radiance. The Radiance is designed for adult women.
Got it.
Now, there could be a researcher out there who wants to take the work we've done on the Radiance and create one for girls. We toyed with the idea. We were going to call it the Cognac. We might do it. I don't know. All of our research has been self-funded or funded by participants. We do not get any government grants. We have not had institutional grants. no one is much interested in funding research into autistic women, particularly a program that is designed to support and enhance them. Cure, that's another thing. And now we have RFK who's going down that rabbit hole as well. So, yeah, I think there is a huge opportunity here for the work that you're doing, for the work that we're doing, for other autistic researchers to run with this and really start to make some inroads into an area that has been woefully ignored.
Yeah, yeah. I mean, and it's so interesting, isn't it? I'm thinking to someone I know who has this exact story. She's now 30, and she is, in fact, now a researcher in the field. She had the good fortune to have a pony, and the pony took up the slack. But not everybody, of course, is in that position. And I guess it's just listening to you speak and thinking about how so many, I think, adolescent girls have this experience of being the one who is bringing emotional upheaval into a family environment, but may or may not have much choice in that matter. And therefore, if this were better understood, particularly when it hits that middle school pain point, you know, how much better could things be? And I suspect they could be much better. So I'm also, it's natural for me to imagine in my journalistic mind, okay, the radiance goes out there and it gets a momentum. And then it would seem to me almost inevitable that a cohort of probably female researchers, but possibly also male, might go, listen, maybe we need this actually much earlier so that we're not picking up people who are so traumatized by, you know, lives gone wrong that they have to kind of rethink and rebuild and reframe in middle age. Do we need to, does that need to happen? No, it doesn't. If we can think more intelligently about this. And this is now the other problem. Remember, we started with tribe. One of the things that's also very difficult, and this is a point I'm making often when I'm working with young autistic adults, is while it is true that neurotypicals must and should meet you more than halfway, you have to meet them halfway too, because that's just the world we're in, you know. And whether that's a should or whether that's a shouldn't, it's an is. And that's a set of survival skills. So it's like, you know, for example, I have to speak other languages. I live in Germany, I have to speak German. I lived in France, I had to speak French. I'll be going to live in Spain soon, I have to learn Spanish. I just will have to. Whether I wanted to or not is completely irrelevant. If I want to be able to get around in America, I have to get a driving license. Do I want to drive? Do I not want to drive? Irrelevant. Got to have one, or it's very difficult. But it doesn't mean that I stop being me. I'm just me with a set of skills. So, but what's so hard for parents, I think, and as you say, in families where there is autism, one of the parents can also be autistic, which can add, you know, variables. They often have no support.
Right.
Without tribe, it's almost, you know, it's almost impossible. And I had this good fortune to spend all this time with Indigenous people where there is a lot of support. No one is left unsupported. Everyone in the community regards anyone else's struggle as something that everyone else has a partial responsibility for. Because if one person fails, the whole thing can fold and everyone gets eaten by hyenas. That's no good. So we step in, and people might grumble about it, but people step in and help automatically. We know that that's just not how things are set up, you know. So I'm just thinking back to your story, Rebecca, you know, I mean, your mum, whatever was going on with her, was also isolated and alone, probably didn't have the skills to cope, you know, might have had some sort of diagnosis going on herself of something or other, who knows, had plenty of struggles, couldn't cope, folded, buggered off, made the wrong decision. But there was no granny, there were no aunts, there was no greater sisterhood or council of elders or two. Yeah.
And well,
I'm wondering if that's
the greater,
yeah. Go ahead.
The greater society here, in modern society in the United States, at least, has largely evolved into a situation like that. There are pockets within this culture where that is still strongly supported. That tribe mentality is still
But very
supported.
few. Yeah.
Very few. And so everyone almost has that isolation because there is not that support. There are some church communities that maybe do exactly what you were talking about, where everybody bands together, and maybe there's some grumbling. There are the elders. There are somebody who is able to cause that group of people to be more cohesive and more supportive of any one of them.
It's cultural too. You talked about the Kalahari, the Australian Aboriginal culture.
Yeah,
Yeah.
same thing.
Is very,
Absolutely.
very much about communal responsibility for every member.
Absolutely. Absolutely. And, you know, in the 25 years or so I was living in the USA, and particularly once we got into this work, I noticed that often when we're in Texas, so a certain proportion of you're in New Mexico, of our clientele was always Hispanic, and they often had better outcomes because there was just more support. There was more familial support.
Yep.
Among the white middle class, very little. And where that might have not been true 50 years ago, there'd have been more family farms, there'd have been more family businesses. It just was not the case anymore. And I when we first started running what we call play dates, we never called it therapy because we're not therapists. And by the way, I never even met a kid that wanted therapy. You know, oh, I'd like some therapy today. You know, no, they might want to play or go ride their pony, or doesn't mean that it can't be therapeutic. But yeah, then we've always called it play dates, you know. But what I noticed was, of course, I needed the siblings there because I didn't know your kid, right? Your kid doesn't trust me, doesn't know me, coming in with an overactive amygdala full of fear. So if I have the brother and the sister there, they'll give me all sorts of intel, like, don't do this, make sure you do that. She hates this kind of sound or smell. She loves that, you know, not that dog, but that dog, you know, blah, blah, blah. When he makes the funny noise, it means this. This is amazing. I need all this, you know. So it might take me 3-4 years of building relationship before I could, you know, learn that about somebody. So I needed to make things attractive for the siblings. So of course, let's say there was a sister, generally, well, riding lessons, you know, happening for free. You know, that was generally pretty good. Maybe the boy didn't care from horses, but he loved soccer or something, or martial arts. And I had friends who were semi-pro soccer coaches. I'd ring that guy up and say, I need you on Tuesday at this play date. And so then the brother would find that he was getting all this amazing soccer coaching because of the siblings' autism, not in spite of. And it changed the dynamic within the family. And then the parents were coming and suddenly saying, oh my gosh, all of our kids' needs are being met. We can actually have time to reach out to each other and swap information, because the best information you always get is from other parents. What worked, what didn't work. And we realized we'd stumbled into tribe. And I was doing it partly because I was so isolated from my tribe. And so I wanted kind of a social life for my kid. I kind of wanted a bit of a social life for me. And I was also curious to see if what we were doing would work with other kids. So I wonder if that's also what you found that you're doing at Wilder Wood. Do you feel that you've actually also created tribe there, and that through these protocols that you're doing, you're helping to create wider tribes, you know, and that wider supports out now away from Wilder Wood?
Yeah, absolutely. And it was almost by default, particularly with our research, that we've created this community of autistic women who are connected now through the Radiance, and the letters and emails that we get outlining the difference that this has made. We got one last week from someone that we diagnosed 2 years ago. And, you know, she was saying since getting the diagnosis, she's found others like her, and she's been able to establish an interest, and she's halfway through a baccalaureate program in psychology. And she wants to go out now and be trained as a therapist to help other autistic women. So she's found that connection, and the thread started with finding this community or this tribe. So.
Do you have plans to set up some sort of, I mean, training where people can learn to do what you do, and then set up effectively Wilder Woods all over the place? Not dissimilar to what we did with Horseboy. There are Horseboy places around to think that that's something that could happen, because I think there's a need for what you're talking about. Quite a
we
strong need.
certainly, well, I appreciate you saying that. I think I look at the things that people like you do, Rupert, and I'm just in awe of you. I think what you do is amazing. I think you're an incredible inspiration. And what you've done for your son and with your son, and by extension, the autistic and the ADHD community, is incredible.
I agree.
I don't know that I have the energy or the drive to do that. I think that getting the radiance out there is important. I think training clinicians in how to use it is important. But I think that offering what I do here and having the opportunity to talk with other like-minded people is also very important. But multiple Wilder Woods, I'm not sure. I don't think
Well,
so.
I wonder if that's something that will happen indirectly. It doesn't, I mean, it doesn't have to happen through like a certification program or something, but I just wonder if that, because surely, you know, when you're going out there and talking to other women with your condition, you're probably at some point saying to them, hey, listen, you need support, and here are some tips for how to find it, right?
Yeah, absolutely. And I really like the idea of other autistic people going out and creating other elements or other parts or other components that they've taken from it, rather than, you know, me and Mark being sort of the ones doing it. I like the idea of it spreading through the community and the community taking responsibility for it, you know, rather than the more individualistic, oh, this is Mark's and my program and, you know, we're going to, you know, teach others. No, take what you've learned from us, reject what you don't like, and go out and do something in your part of the community so we can create and spread this.
Yeah, this is an interesting thing that we've also experienced is people, for instance, we put on a community event in Albuquerque. It was called Odd Fest last year.
And I saw some stuff on it on your website. Yeah, it looked great.
Oh, yeah.
It was great. And there were some of the people who made comments on a Facebook or something like that were saying, well, you could have done this and you could have done that. And why didn't you do this? And our response to each other in our kitchen or was, why don't you do it? We did this. You go ahead and do that. That's your idea. Go for it. Because what ends up happening in a lot of these instances is people like you, Rupert, people like Rebecca, are amazing people and are looked at for that drive. It is to some degree very, very inspiring to others who somehow don't have the same intellectual, mental capacities. Because there is a spectrum of that within humanity. And those who are part of the tribe and yet do not have certain attributes that allow them to do those things with facility end up dropping the ball. It's sort of like if there was in religions, there is the guy who is the Buddha, who is the enlightened one, or the Christ, who is the enlightened one. And then there's the people who are immediately around that person, and they sort of get it, but not like that person did. And after about 2 or 3 iterations down the road, it becomes like the whisper game where we're whispering a sentence to someone and that sentence goes around the circle. It's not the same sentence by the time it gets back because you know what you're doing. Rebecca knows what she's doing, and you do it very, very well. And then it slightly gets diluted or changed a little bit, and then it gets changed a little bit more.
Yeah. No, I agree. That's an organic process, right? And I think,
Yeah.
this used to keep us up at night years ago. And then we realized, well, hold on. In that case, if this is keeping us up at night, then that means we need to simplify. What's the simplification of what we do? Because there's all these different nuances, right? And we realized that there's just this one thing. If you're doing it, you'll probably be successful. And you could take any of the tools that we offer and run with them. And that's why, like, our programs they're just toolkits. They're just like saying, here's a bunch of tools. You're probably already doing something pretty awesome, because a lot of people that we train are, already doing good things, right? Don't change what you're doing. Here are just some tools that you might find useful. So there's one thing that allows those tools to be used, and that's the ethic. It starts with the autistic person. It starts with Temple Grandin, and the advice I got, which we never deviated from, which is follow the child.
Yeah, it's
And
great
as long
advice.
as you're doing that, you know what I mean?
Yeah.
Because then it's not about horses. If the kid's not into horses, but he's into balloons and bicycles and Minecraft, I'm all about balloons and bicycles and Minecraft.
Yeah, there you go.
Then the horse is my therapy, so that I can put up
Good.
balloons and bicycles
Yeah.
and Minecraft, which I don't find interesting, but I can mask and pretend to find it interesting because I'm interested in that kid. But then the horse is actually helping me more than the horse is helping. But it's follow the child, follow the child, follow the child. And it sounds like basically that's what a lot of the radiance is coming down to, which is,
Yes.
right?
Absolutely.
Yes, it
Follow
is.
the autistic.
Autistic woman. Right.
And then if
And,
there is a bit of
yeah.
a process of, as you said, Chinese whispers down the line, if you build that in to the radiance, and it seems that you are, then it just becomes a great toolkit that anyone can use. And yeah, sure, some people might use it better than others, but at least it's there, and at least it's an improvement on the status quo. And you've got to follow yourself as well, Rebecca. So you're always thinking back to yourself as that 15-year-old girl. Could this have improved things if it had been around back then? The answer is for sure.
Oh God. Oh God. Yes. Oh God. Yes. Yeah.
And it's been
Yeah,
good for the
because-
world that you went through that story, because you've done something really good with it. But as well as I do that not every girl has the same outcome that you had. And we don't want every girl to have to go through that. No.
Right.
No. So I
Exactly.
massively appreciate what you're doing.
Well, likewise, we're pretty much in awe of you and what you continue to accomplish and have accomplished. And we're just I can't speak for Mark, but I was quite amazed that why does Rupert Isaacson want to talk to me? Someone like
we're
Rupert
all in
Isaacson.
this field, and because there was a time, this, Rebecca. I mean, 10 years ago, we were all getting laughed at. You were just playing with ponies, and my answer to that was, "And what's wrong with that?" But then I realized, then maybe I better go talk to some neuroscientists and find out actually why that's a good thing. So that when people said that to me, I could say, okay, so here's what's going on in the brain when you do this, and here's what's going on in the body when you do this. And then they go, oh. And then I could say, so where did you get your degree in neuroscience? So you clearly, and then that changed the thing completely when they got on board. But we had to be laughed at for years before we got there. So no, why do I want to talk to you? Because you're improving the field, guys. And you're getting the job done, and I respect that, and I want to big you up, and I want people to know about you, because we're all going to be dead someday, and this has to go on. We can't be going back to where things were 20-25 years ago. No. So the fact that you guys are advancing the field in this thoughtful way and devoting your lives and your resources to this is incredibly important. Of course I want to talk to you. Of course I want to know about Wilder Wood. I mean, goes without saying. By the way, there's an unsung hero in all our programs, and that is Ileana Lawrence, who is my wife and who is the person who's responsible for the systematization of these things so that they can be really taught and really replicated. And she's super modest, and she won't ever come on a podcast, and she won't, but were it not for her, no, this wouldn't be happening. So it's not all me by any stretch of the imagination. I happened to, if I had one good idea, I had one good idea, and that was I went to talk to Temple Grandin. And then my second good idea was I said, yeah, I'm going to follow that advice. But I can't say that was through any natural talent. That was just common sense. It's like, there's someone who has the knowledge. Go to that person. Try it. Does it work? Oh, it works. Keep doing it. And I think, yeah, we're all in this boat. And we had a breakthrough last year with our programs in Ireland, where there's an amazing man who you need to be aware of called David Doyle, who's an autism dad who started amazing work all over Ireland, and based around the situation he found himself in with his daughter 30 years ago. And he proved at the place that he got going called Liskinnet in County Limerick, look it up, Liskinnet Farm, I'll send you a link, that using movement method with autistic adults who were violent and who often needed up to 4 minders, by the time someone's 6'4" and 250 pounds and is so frustrated and so boiling over with 30 years of sensory stuff, and the score, that anyway, that with this over 5 years they could bring that number of minders down to 1, and that of course saved the government over €1 million per person. And after 5 years of collecting the data, finally the Minister of Health and Disability in Ireland, which is amazing, they have a Minister of Disability.
Yeah, really.
It's incredible, eh? When, you know what, the data's good, and they got behind it. This was between 15 and 20 years into the work we were doing. And then that begins to have a knock-on effect within the EU, which then has a knock-on effect back to the UK, which then has a knock-on effect back to the US. Because as you know, you're never an authority in your own backyard. Your stuff will be adopted in Germany.
You're right.
Adopted across the USA. It's just how it goes.
Yeah.
And that's the other reason why we all need to be talking. And that's why we need podcasts like this, because we need to be aware of each other. Because I'm going to be talking. So we have so for listeners, you're going to be listening to this whenever, but this happens to be July of 2025. So in August of 2025, we'll be having what we call our Horseboy Tribe Day. We should really call it Tribe Days because it's over a long weekend. And we get together internationally. And this year it's in one of our places in Ireland, a place called Stewart's Care, Kilcloon, just outside of Dublin. Well, I'm going to be talking about you, and I'm going to be saying, go check that out, because that's what we all rely on each other to do. We're like, how I wouldn't know this. I only found out about you because of our mutual friend, Lisa Dearson.
Lisa.
Yeah.
So listeners, if you haven't heard my podcast with Lisa Dearson, who does the Equus Film Festival, it's over on my Live Free, Ride Free podcast. Go and check her out. She's an amazing human being with a heart about as big as Chicago, where she comes from. And she turned me on to you back in April. She said, Rupert, you've got to check these people out.
Oh, well.
Yeah. And if Lisa tells me, I take her word for it, So I looked you all up and I went, oh yeah, no, they're the real deal. They're doing it. But without her turning me on to you, I wouldn't have known.
Yes,
we're also
exactly.
Too much. Too much information out there.
Back to tribe again and tribal communication.
That's right.
So back to putting stuff out in the world. You've also written a book. Tell us about the book.
Yes. Oh, I wrote it at the urging of Marc, because my attitude was, well, who wants to know about me? Nobody's interested in me.
That's still your attitude.
Well, the thing is, where you're right about that, honestly, is they're not interested in you. They're interested in your story. When people read The Horseboy, they're not interested in me. They're interested in the story. So you're right in a way, but you do have a very good story. So tell us the story.
Well, it's just basically what I went over earlier today. It's just the story of what happened to me, and that I was basically abandoned, gave up on. I had a grade 9 education, autistic, no family, no support, no money, no nothing. And I kind of worked my way through it, and, ended up going back to school and getting now 4 degrees and doing what I do. And it was basically that was the story. And interwoven through that, how horses and my love of horses and my ability to connect with horses probably saved me, because it was the one constant in my life. If I didn't have a horse, I was reading about them. I was thinking about them. I was I had them in my heart. They have been a constant throughout my life. And I'm so incredibly grateful to this guy beside me for opening up the opportunity where I can now, and have for the past 12 years, lived again with horses.
Well, one other thing that I want to put out for in the context of the book, that was an unspoken thing, but something that Rebecca and I have both talked about, is this concept of learned helplessness, an ironic concept that people, whether autistic or not, who have certain things that are accommodated for them, actually don't learn as well how to do those things because it's easier for them. Rather than going through what Rebecca had to go through because that was her life. She did not learn helplessness. She had to find ways. Her executive function is very poor, but she had to compensate by having 3 different memory devices, her moleskin, her diary, and a second set of, on the computer, of calendaring that she invented for herself out of necessity. If she hadn't learned and taught herself to do that because there was no one else around, she would not be here with me today. And I reinforce this fairly often. This concept of learned helplessness is intermingling with societies, that first world societies, that are so easy to get just about anything you desire. Things
I mean,
that you desire.
it's rendering neurotypicals helpless.
That is accurate. That is accurate.
The assumption that everything is going to be at your fingertips all the time means that,
and
don't work.
you going to the Kalahari, or me going out backpacking in the mountains of New Mexico or Colorado and getting lost, sometimes on purpose, so that I'm challenged, and you were challenged, because the hyenas are out there.
Oh yeah, they are.
and that's the metaphor for all of it. In the first world, the hyenas are the bankers and the businessmen, and they are the ones who are there waiting.
Get this.
To take you.
In the hunter-gatherer context, which is the authentic human context, right?
Mm-hmm.
The predator is never, and I repeat, never, your fellow human. They don't kill each other. They don't prey upon each other in those ways. That comes in after they're displaced. Then society breaks down, and then they do those things to each other. But when things are going authentically, so human culture is actually, in its authentic sense, a culture of conflict resolution, not of conflict creation. Now we live in a society where the only predator is our fellow human. And that sends us nuts, because it is nuts. And that means that even if you're neurotypical, it's no holy grail. You're going mad with a certain kind of psychological pain, because you're living in the world that's as it should not be. And a part of your subconscious is like, this is wrong. And I think everybody has that voice screaming all the time, but you might not even know why, because you're so far removed. It's not your fault. This learned helplessness thing is so interesting, because one does need to be taught skills. And it's so interesting in those hunter-gatherer contexts, kids are given absolutely unconditional love. They're always carried on the body. You're not going to put them down where there's snakes and scorpions. They're always between 2 adults at night, because if you put them on the other side of a hyenas will come in and they will take your kid and you will not wake up. They know how to do that. So you wouldn't dream of putting them even half a meter away from you. They'll take your boots if you take your boots off, and it's also below freezing at night. So you're going to have the child here, and then it will graduate to a pack of siblings and blah, 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 blah. But what's so weird with that level of support is that when they reach about 16, they can take a spear, go into the bush, dodge all the dangerous stuff, come back with a meal for everybody. 2 years after that, they can go down to Johannesburg in the city and get a job in the mines, learn to speak 8 languages, suddenly learn to be a mechanic because they've just kind of looked at their powers of observation are so good from tracking. They can just kind of, oh yeah, I can do that. And then they learn to fix trucks and so on. And it happens boom, 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 boom. So it seems that this total support in
Patterns.
the early stages leads to total independence later. We seem to have it the other way around. And that, let the kid cry it out, make them be tough early. And of course, it just leaves them with great psychological holes. I mean, any of us, that we then have to fill in with things like alcohol and whatever. So it's a different type of learned helplessness. I agree. And that seems to come down to tribe again. And would you not agree that, because you wouldn't want everyone to have to go through what Rebecca went through, because there'd be a wastage and a casualty and attrition rate there that, no, we don't want that.
I would not recommend it.
No. But what if the horses can help us with that? Because horses, as you know, they're going to give you that feedback. Yes. And you're going to make mistakes, and sometimes you get clonked, and sometimes you're going to have to modify your behavior around them because they just are. And they're going to teach you. So with programs like yours, I think, you can take someone who might have been in Rebecca's situation and say, we're not going to do everything for you. It's not learned helplessness, but it is a safe container where you can do that. Educate.
Yes, and that's the youth programs that we've had are basically doing that. There's the horse. Here's the rope. He has a halter on. We're going to let you figure out how to catch him. Go ahead.
Yeah.
But it's not Desmond, because they'll never catch him. It's Digger, who is happy to be caught, but he'll walk a little bit away. And then someone would graduate
to Desmond.
Yeah.
So that it is an attainable task, but you hand a rope to someone and say, for that has never been around a horse before, and maybe has been here one time, adult or child, it doesn't matter. Here's your rope. There's the horse.
Yeah.
What are you going to do?
And you're going to learn to help yourself starting here. And there'll be no punishments. If you get it wrong, there'll be no negative outcome for you. And
try something different.
If it doesn't work today, we'll figure it out tomorrow.
Exactly.
But figure it out, we will. Yeah. No, I so respect that. We talked about the book. We didn't hear the title of the book.
Oh, it's Joy.
We like joy.
Joy.
Yes, because this is the other thing, I love that you have that word, because when we're training people, we're always saying, well, the problem's not autism, right? Because there's lots of successful autistic people, and the problem's not schizophrenia, because there's actually quite a lot of successful schizophrenic people. And the problem is the suffering that goes with finding yourself in the wrong place with these, overwhelmed by all this stress.
Mm-hmm.
But so the problem is actually suffering, not the condition, because these conditions have always been around. So what is the opposite of suffering? If we want the opposite of suffering is joy.
Joy. Yes.
Yeah. So that's what we, if and again, follow the child. I love that you called it joy, because that's what we have to do. And if one gets these life skills, what's the point of them? The point of
without
them,
joy, right?
Yeah, and to experience joy, to be able to access joy.
Right.
What do ponies bring into our lives?
Oh, absolutely, absolutely joy.
Yeah. We are great purveyors of joy. That's what we do. It's we're lucky that we can do that. So listen, guys, we've hit the 2-hour mark. I'd love to have you guys on again.
Sure.
I feel we've only scratched the surface. But how do people find out about you? Give us the web stuff. How do they find out about Radiance? How do they find about equitherapy and autism? Where do they get your book?
Website is the best place, wilderwoodequinetherapy.org.
Wilder Wood Equine Therapy, all one
Equine
word.
Therapy. Yes, .org. O-R-G.
Mm-hmm.
Mhm.
And
And the book's on Amazon.
Joy by
It's on
Rupert
Amazon, yeah.
Evanko.
Evanko, thank you.
Evanko. Guys, thank you.
Thank you
Thank
so
you,
much for the invitation.
Rupert.
It
We're
was
very grateful.
very wonderful, and we feel very privileged to be having had the chance to talk with you today.
Well, likewise. Thank you for making the time. And we will do it again.
All right.
Take care.
Take care, guys.
Thanks a lot.
Bye-bye.
Okay.
Bye-bye.
I hope you enjoyed today's conversation as much as I did. If you like what we're doing here, please do like, subscribe, tell a friend. It so helps us to get this valuable work done and the message of equine assisted stuff out there. And if you're interested in more conversations, you might want to check out our Live Free, Ride Free podcast. And if you'd like to support the podcasts, please go to rupertisaacson.com and click on the Patreon link. If you're a professional in the equine assisted field or are considering a career in the equine assisted field, you might want to check out our 3 certification programs: Horseboy Method, Movement Method, and Taquine Equine Integration. You can find all of those over on newtrailslearning.com. And finally, if you want to check out our cool rock and roll themed merch, back on rupertisaacson.com, please click on shop. You'll find all kinds of fun goodies there. And if you're looking for a way to spend time until the next podcast, you might want to consider reading the books that kicked all this off: The Horseboy, The Long Ride Home, and The Healing Land. So see you next time on Equine Assisted World. Join us for the adventure.